Hello, I'm Barbara Nemko, Napa County Superintendent of Schools, and I am delighted that our office is able to bring you this discussion tonight about pediatric COVID-19 vaccine. As a child who grew up before there was a polio vaccine, to me, the word vaccine has always meant miracle, something that could bring us back to the normal life that we enjoyed before. And so my whole family is vaccinated, including my 10-year-old and 12-year-old granddaughters. But I know that you may have many questions, and we have the best two people tonight to share information with you. I'm going to first introduce Dr. Karen Reluccio, and she will make a presentation, and then I will introduce Dr. Joe Carrillo, and he will make a presentation, and then we will answer your questions. So Dr. Karen Reluccio has been the Public Health Officer and Deputy Director at the Napa County Health and Human Services Agency since 2015. She runs a division with 17 programs spanning communicable disease control through emergency preparedness and all kinds of programs to serve families and children. I'm going to do this quickly so we have time to get to your questions. Before she came to Napa, she was Medical Director of Public Health Clinics, and she worked for the San Mateo County Health System. She was also a clinical instructor at Stanford University Medical Center from 2003 to 2006, and she's president of the Health Officers Association of California and past president of the California Conference of Local Health Officers. She was appointed to the state's Commission on Emergency Medical Services by Governor Jerry Brown in 2019. And so I am honored to introduce Dr. Karen Reluccio.
Thank you. Okay, thank you very much. So I'm just going to talk about some background around the COVID-19 vaccinations in pediatrics. Next slide. So as you know, the Pfizer pediatric COVID-19 vaccine for those that are aged 5 to 11 years was approved by the CDC, as well as authorized by the FDA for emergency use authorization in children 5 to 11 years of age. And this is based on a clinical trial of over 4,600 people where the two-dose series of 10 micrograms each was given 21 days apart. So it's basically a two-dose series. So in terms of safety, the most common side effects were injection site pain and swelling, as well as fatigue, headache, muscle and joint pain, and all of these other symptoms that are seen in adults that have received their COVID-19 vaccine. Serious adverse events were uncommon among vaccine and placebo participants, and none of the reactions were judged to be related to vaccines, and there were no deaths. And then it was also noted that children in this age group may experience fewer side effects than adolescents and young adults. It was found that the vaccine efficacy is over 90% against symptomatic COVID-19, and immune response in children 5 to 11 years was very comparable to that of individuals that are aged 16 to 25 years of age. Next slide. So I just want to talk about COVID-19 in children 5 to 11 years and what the disease has looked like in this age group. So there have been over 1.9 million reported cases in the United States with a seroprevalence estimate of about 40%. So what we're seeing is that, it is more common in kids than what is reported. There have been 8,300 hospitalizations to date, and it has been 3 times higher for African-American children, American Indian and Alaska Native, and Latinx children as compared to non-Hispanic white children. And 1/3 of hospitalized children ended up in the intensive care unit. In addition, in this age group, there is a serious disease called multi-inflammatory syndrome in children, or MISC, which is most common among this age group. And also long COVID is seen in this age group as well. And then, of course, there could be secondary transmission that occurs in household and school settings from 5 to 11 years old. And it could lead to lost in-person learning and other adverse outcomes, such as loss of a parent or grandparent caregiver because they succumb to COVID-19. Next slide. Next slide. Oh, sorry. So I just want to talk about, how Pfizer has been effective against people that are 12 to 18 years of age. So there is more data that has been published where hospitalized patients aged 12 to 18 years of age, the vaccine effectiveness of 2 doses of Pfizer against COVID-19 hospitalization in this age group was 93%. And this is during June to September of 2021, where there was the Delta variant that was prevalent across the United States. In addition, adolescents hospitalized with COVID-19, of those that are hospitalized, 97% were unvaccinated and 3% were vaccinated. In addition, no vaccinated adolescents that are hospitalized with COVID-19 were admitted to the intensive care unit. So it also protected against more severe disease. And the findings reinforce the importance of vaccination to protect US youths against severe COVID-19. Next slide. I do want to talk about myocarditis because I know that this is an area where a lot of parents would be naturally be concerned. So myocarditis, which is inflammation of the heart, and pericarditis, which is inflammation of the covering of the heart, have occurred in some people following receipt of the mRNA COVID-19 vaccine, typically within a few days after the second dose. And the observed risk is highest in males 12 to 29 years of age. The risk of myocarditis after receipt of an mRNA COVID-19 vaccine is lower than the risk of myocarditis associated with COVID-19 infection in adolescents and adults. So, a lot of viruses and other infectious diseases cause myocarditis. In addition, no cases of myocarditis or pericarditis were reported in the clinical trial for children 5 to 11 years of age. However, the study was not powered to assess for myocarditis risk. Additionally, the baseline risk of myocarditis is much higher in adolescents 12 to 17 years of age compared to children 5 to 11 years of age. And the benefits of vaccination outweighs the risk in this population. Next slide. So these are a long list of infectious causes of myocarditis, of which COVID-19 is one of them. Next slide. So, any people that are receiving mRNA COVID-19 vaccines, especially males less than age 30, should be made aware of the possibility of myocarditis and pericarditis following receipt of an mRNA COVID-19 vaccine. But if we take this into perspective, studies demonstrate an incidence of 5.6 to 12.8 cases per million for vaccine-associated myocarditis versus 450 per million for COVID-19 associated myocarditis. The thing to look out for, is to seek care with your pediatric provider for symptoms of chest pain, shortness of breath, or skipping heartbeats, fluttering or pounding heart. Next slide. So in summary, children should be vaccinated because over 6.3 million children have been infected with COVID-19 and more than 22,400 children have been hospitalized. At least 605 children 18 years of age or younger have died, and over 5,200 patients met the case definition for multi-system inflammatory syndrome. And there have been 46 deaths among those that had MISC. In addition, the patients with SARS-CoV-2 infection had 16 to 18 times higher the risk of myocarditis compared with patients without COVID-19 infection. And the risk of myocarditis in individuals following SARS-CoV-2 infection is 6 to 34 times higher compared to those who received the vaccine. Recent studies show that around 2% of children experience post-acute sequelae or long COVID and symptoms that persist beyond 56 days. So there are serious manifestations that can happen after COVID-19 in individuals. And then just to end with the fact that there has been a hidden US COVID-19 pandemic, which is orphaned children, where over 140,000 children under the age of 18 lost a parent, a custodial parent, or grandparent caregiver who provided the child's home and basic needs, including love, security, and daily care. And 1 out of 500 children in the United States have experienced the COVID-19 associated orphanhood or death of a grandparent caregiver. And there are definitely racial, ethnic, and geographic disparities in COVID-19 associated death of caregivers as well, which does have implications on, it causes trauma for children. So I think that's just something to keep in mind. Next slide. And then, aside from Bayer's, there are multiple surveillance systems that look at vaccine safety. So Bayer's is a very small part of vaccine safety surveillance. And as you can see here, there are multiple systems, including VSafe and VSD, which looks at millions of people, including, and then there's two more databases through the FDA, through Centers of Medicaid Services and FDA BEST. So this is being looked at across the nation, and it's not just limited to Bayer's. Next slide. And that's the end of my presentation. Barbara, you're on mute.
Thank you, Karen. And thank you for those very important statistics. Karen has worked harder than anybody should have to over the past few years, and we really owe her a huge debt of gratitude. So thank you, thank you, thank you. Karen also mentioned that you might want to talk to your pediatrician. Well, if your pediatrician is not handy right now, we happen to have a wonderful pediatrician, Dr. Joe Carrillo, who is at Harvest Pediatrics. Dr. Carrillo has been a very beloved and experienced pediatrician in Napa County for 18 years. And in fact, it seems like most of the people in our office who have children of pediatric age are patients of his. So they all absolutely adore him. He moved to Napa from Boston. He was at Boston Children's Hospital in a leadership role. He was a pediatric faculty member at Harvard Medical School. He mentored medical students to become community health providers, and he has served on the boards of Queen of the Valley Medical Center, the Napa Valley Community Foundation, and currently serves on the board of Olay Health. And I had the pleasure of working with Dr. Carrillo shortly after he arrived in Napa as part of the Children's Health Initiative, where we were trying to ensure that all children in Napa County had health insurance. And of course, we were successful because we had lots of community partners and people like Joe working with us. He loves being a pediatrician and thinks it's an honor and a privilege to care for the children in our community. So I can't introduce anyone with more expertise as a pediatrician who would be better than Joe Carrillo. So take it away, Joe.
Great, thank you so much, Barbara. It really truly is a pleasure to be here this evening, and especially as we begin a next week of celebration of giving gratitude for all the many blessings that we have. So I'm here to share with our parents in the Napa Valley a pediatrician's perspective on the COVID vaccine. I can honestly say that the COVID vaccine is safe and effective. You know, us doctors are not in the business of causing harm to children. The partnership that we have with your family is based on trust. And we would never recommend a vaccine that if we thought it would adversely affect your child. As in anything in medicine, there's always a risk. But I can confidently stand before you this evening and say that the benefits far outweigh the risks. The most common side effect from receiving the Pfizer vaccine includes some pain and redness or swelling at the injection site. And your child may have other symptoms that include fatigue, headache, muscle discomfort, maybe a low-grade fever, nausea, and decreased appetite. But the serious side effects from the vaccine are rare. And in the past 2 weeks, we have been administering COVID vaccine at Harvest Pediatrics, and we've administered over 300 doses so far. And in the course of these clinics, we have seen minimal side effects in children. And we know that the vaccine is 91% effective in preventing serious COVID infection. And that is so much better than the flu vaccine we give every year, which ranges between 50 to 60%. So as Dr. Lucio reviewed that many children, and in this particular age group, about 2 million children in the United States, age 5 to 11, were hospitalized for COVID. And of that 2 million, 8,300 required hospitalization. And when you look at it further, about a third of those kids who contracted COVID had to be admitted to an intensive care unit. And the main issue that a child experiences when they contract COVID is an inflammation of the blood vessels, and the blood vessels that supply our internal organs, such as our heart, liver, kidneys, stomachs. And it is a serious inflammation, and it can have long-term lasting symptoms. And again, this was seen amongst children with actual COVID infection. So you as a parent might say, well, Dr. Carrillo, the risk my child has complications from COVID infection is really low. And I would respond by saying, yes, this is true, but we cannot predict with confidence if your child will not be the one who has significant inflammation of their internal organs and potentially long-lasting symptoms. It's like playing Russian roulette with your child's health. I personally would not be willing to take the risk for my child when there was an intervention that could potentially prevent the disease and significant complications. Another concern I've heard from parents is that the vaccine was made so rapidly and has not been around for as long as our regular childhood vaccines. And I would say, yes, this is absolutely true. However, the SARS-CoV virus has been around for many decades. And the advancement we have seen in the science and technology of vaccine has been tremendous in the past decade. Our knowledge of how viruses work is unsurpassed than any time in history. The development of the mRNA vaccine is an example of this progress. It's highly effective and safe. I have to share with you, in the 30 years that I have been practicing pediatrics, I have witnessed the significant impact vaccines have had in the lifespan of children. When I was a young pediatrician in training, our hospitals would be filled with infants and young children with bacterial blood infections and meningitis. If an infant or young child came into our clinic or emergency room with a fever of over 101, they would be guaranteed this would get a blood draw, have urine collected, get a chest x-ray, and then undergo a spinal tap. And more often than not, they would be admitted to the hospital for IV antibiotics until we were certain they did not have a serious bacterial infection. Since the creation and widespread administration of the pneumococcal and Hib vaccines, we no longer see these types of infections. This has resulted in huge savings in healthcare costs. And most importantly, we no longer see children who have the long-term consequences from these infections, like hearing loss, learning disabilities, seizures, and the worst outcome, death. So I would say children need to receive the COVID vaccine. COVID infection is serious, complications are preventable, and it is a tool that we can use. And I would like to add that in terms of the school setting, it will still be of the utmost importance to continue COVID precautions despite being vaccinated. And that includes wearing a mask, frequent hand washing, staying home if you're sick, and the student has a confirmed negative COVID test. Suppose we as a community continue to vaccinate children, adolescents, and adults against COVID and continue to follow public health precautions. In that case, we can look forward to the day when we get back to normal. And I just want to reemphasize what Dr. Relucio said about the hidden epidemic in children during the COVID pandemic. And we all know kids learn best in a school setting. And we want kids to go to school safely where they can learn and thrive. But the other little piece is that, many children have experienced significant loss with a parent or a grandparent or a caregiver, even a teacher or a coach. And that's going to have long-lasting impacts on those kids. And I know as a pediatrician in all age groups, we have seen fear, anxiety, depression, social isolation, and these impacts are real, and they cause trauma to the emotional well-being, mental health of kids, and ultimately impact their ability to learn. So please, will you get your child vaccinated? Access to the vaccines for your child is readily available. You can get it in your pediatrician's office, your family practice office, or the health center. So the vaccines are free. There is no cost. So please, you can call Harvest Pediatrics, Napa Valley Pediatrics, Olay Health, Napa Kaiser Pediatrics, or the Public Health Department to get your child vaccinated. Thank you and have a blessed Thanksgiving.
Thank you so much, Dr. Carrillo. Appreciate those great words. Yes, we want to have a wonderful Thanksgiving free of COVID. So we would like to take some questions now. And if you would like to submit a question, we already have some, but if you have one and you haven't submitted it yet, click the Q&A button on the right side of your screen and then type and submit your question. So we'll start with the first question from Colleen, and I believe it's for Dr. Relucio. Are the statistics that you gave us nationwide or California only?
Yeah, those are national statistics. One source is from the American Academy of Pediatrics and the other one's from the CDC.
Thank you. Question from Shirley Knight. Since the beginning of the COVID situation almost 2 years ago, how many children under 18 in Napa County have been hospitalized or died from COVID-19?
We have not had any deaths in children in Napa County from COVID-19, but there have been probably less than 10 hospitalizations. We have one of Napa County residents who is a child who has MISC, and it's unclear if she is going to survive. So there are serious manifestations that have been seen by this disease.
Thank you. AP says, could you clarify the definition of safe and effective, please? Historically speaking, an effective vaccine means not getting the disease. Also, quote, serious side effects are rare, unquote, doesn't provide statistics. Please help us fight the war of the words by arming us with statistics. Thank you.
Yes, so and I'm happy to have Dr. Carrillo jump in as well, but so there are two main objectives of vaccines. So there is one of them is to prevent infection, and the other one is to prevent hospitalizations and deaths. So and based on what we've been seeing with the COVID-19 vaccine, with some people, with people getting it, even though they got the vaccine, it is having a significant impact in preventing hospitalizations and deaths. So I just want to start with what effectiveness is, and that we talk about effectiveness of preventing disease, and there's the effectiveness of preventing serious manifestations of disease. And then in terms of safe and effective, I mean, I think that, a lot of, so in terms of safe, I mean, the majority of people that have gotten the COVID-19 vaccine have not had side effects or long-term side effects from it.
And I would agree with Dr. Lucio that, we have administered millions and millions of the vaccines, and serious side effects have been minimal. And I don't have the specific numbers, but it seems on just an overview, the vaccine is very safe and it is effective in keeping people out of the hospital and keeping from serious complications from the actual infection.
Thank you. Next question. What do you think about vaccinating children who have had COVID already and have made a complete recovery?
Well, I don't know if Dr. Lucio, but from what I understand, children who have already had the infection should still receive a COVID vaccine. And that in the studies that was looked at, the kids even had a stronger antibody response against the virus in that situation.
Yeah, I totally agree with what Dr. Carrillo is saying. And in addition, it is really unclear how durable and how long-lasting immunity from natural infection is. There are studies that look at long-term immunity, and there have been considerable reinfections for people that have not been vaccinated. So I think that the best scenario is to be vaccinated even if you've had COVID-19 disease. And part of it is because, we know that the circulating, the variants have changed. So, the disease that we saw in the beginning of the pandemic was mostly with the alpha or the wild type virus. And now we've got a lot of the Delta virus, which is a lot more infectious. So it has changed and evolved.
Thank you. Next question. What's the difference between emergency and full FDA approval? What needs to happen for it to have full FDA approval?
Yeah, so in an emergency situation such as a pandemic, where you have a novel virus or an unfamiliar strain of a virus that's causing disease in lots of parts of the world, the emergency use authorization, it's not full approval, but what it is they pretty much weigh the risks and benefits of having a vaccine or a medication that has not gone through all the steps or the different phased clinical trials. So there's phase 1, phase 2, phase 3. It goes through all these different trials in order to get full FDA approval. So an emergency use authorization is basically, it doesn't go through all those steps, and it gets authorized for use because of an emergent situation such as a pandemic. An example of this was in 2009 when there was the H1N1 influenza pandemic, and there were some antiviral medicines that did not undergo full FDA approval, but they were being used basically to treat people in the intensive care unit that were dying from H1N1 influenza. So this is an example of a situation where emergency use authorization is used in situations such as pandemics.
Since the COVID-19 vaccines do not stop infection and transmission, but were developed to reduce hospitalization and death among children under 18 are rare, and since the COVID-19 vaccines do carry risks, why should a parent take that risk?
I think you're muted, Dr. Carrillo.
From my perspective as a primary care pediatrician, you know, yes, the risk is small, but they're potentially very serious. And given that we can't, like I said, we can't know with confidence who's going to be the one who has those serious complications.
Okay, next question. Are the vaccines going to be mandated for children to go to school?
Yeah, so this is something that has been put out by the governor's office, where the governor has directed the California Department of Public Health to add COVID-19 vaccines as soon as there's full FDA approval, not under a emergency use authorization, but once there is full FDA approval, it gets added to the list of vaccines that's required for school. Since this is being done through a regulatory process, instead of a legislative process. So I don't know if any of you are familiar with SB 277 or 377, I can't remember the number, where personal belief exemptions were taken away. If this when there's full FDA approval of this vaccine, what will happen is that you know, people can either have a medical exemption or a personal belief exemption under when CDPH adds this as part of the vaccines for school.
Okay, next question. Do children get a smaller amount versus older people?
Yes, they do. The 5 to 11-year-old group get a dose that's a third of the adult dose. They still get a booster 3 weeks later, but the dose is far less than the adult dose. And
thank you. Next question. Have any other countries immunized young children against COVID?
Yeah, I would have to look that up. I don't know. I haven't been I've been pretty much watching what's happening locally and in the state, and quite honestly have not had time to research what's happening outside of our country.
I'm lucky. I think you're lucky you have time to have a meal every now and then. I understand why you haven't had time to research this. Here's an interesting one. Can I give my child acetaminophen or ibuprofen before vaccination to prevent side effects?
that is something we usually do not recommend as a preventative measure. You know, when vaccines are administered, they work because the protein is injected into the muscle that causes an immune response. It causes your immune system to come and recognize that as foreign, and antibodies are created from the protein. Those antibodies then go back into your immune system so that if your body were ever to see that particular virus or bacteria, antibodies would be made by your own immune system to kill that bug so it does not become a serious infection. So the thought is you want to get the best immune response you can get when you get a vaccine. So fever is part of your immune response. We frequently discuss this with parents, that fever is not actually a bad thing, it's a good thing. It means that you have a healthy immune system and your body is responding. So as a usual course, we do not recommend doing that prior to vaccine. But of course, after the vaccine, if the child is uncomfortable and has a fever over 101 and is miserable, absolutely, of course, give Tylenol or ibuprofen.
Thank you. Here's another question. Do I need to consult my pediatrician
About
getting the 5 to 11-year-old vaccinated?
Well, I know in our community, And I know all the pediatricians and the family practitioners who take care of kids, and I'm confident they all would say, yes, get it. That's one of the best ways we can get this pandemic under control.
Okay, thank you. Next question. Does the vaccine provide longer duration protection than the protection you get if you had a natural infection?
Yeah, I think this is an area that is still, that's still unknown. It's unknown how long a natural infection, how durable and long lasting the immunity is. And, with the vaccines, what we've also seen is that it has, that effectiveness does wane after 6 months. So I think, it's pretty much, I think that's where, there's still a lot more studies that have to be done in order to look at this. And what we're seeing though is that people that have had COVID-19 and then get vaccinated, that is actually, there's probably the most strong, durable response against COVID-19. But there's just more studies that have to be performed in order to come to a conclusion on that.
Thank you. Here I have 2 more questions. If when the vaccination is mandated for children to attend school, are we looking at an annual booster shot for our children every single school year?
Yeah, at this point, it's too early to tell. And it's, it's really unclear if, will the mRNA vaccine be slightly different every year, like the flu vaccine is different every year? I think there's just a lot more, information that's unknown about, what that is going to look like.
Thank you. Next question. My child had no side effects from the first vaccine other than a sore arm the next day. Should we expect more fever, discomfort, or pain at the injection site for the children's second vaccine, like many adults experienced?
Well, but not necessarily. What the experience we have seen so far in this age group getting vaccinated, the side effects have been far less than the adolescent group or adult group. And it may be directly related that it's a smaller dose, but we also know that children have much more elastic, nimble immune systems because they're young, their cells, their immune systems are young. So I would suspect that they will have a nice, strong response to prevent serious infections.
Thank you. Next question. My child just got a different routine vaccination. Can my child still get a COVID-19 vaccine?
Yes, absolutely. You can still get your regular childhood vaccinations. At first, I have to be honest, there was a lot of confusion at the beginning with all these vaccines. You need this, needed to wait this, you couldn't get this, but that has truly all relaxed. So in the clinics we've been doing in many children, and it's supported by the Centers for Disease Control, is that you can receive a COVID vaccine and a flu vaccine at the same time.
Thank you. Next question. Can my child get COVID-19 from getting the vaccine?
Absolutely not. It's not a live vaccine. It's a vaccine made from messenger RNA, which is a protein. There's nothing live about the vaccine, and you can't get the disease from getting the vaccine.
Thank you. That's a really important thing for everybody to remember. And the next question, can COVID-19 vaccines cause variants?
No, the COVID virus itself has, mutates a lot. So, and the reason why it does is that its machinery doesn't detect errors when it replicates. So this is why there are so many different variants of COVID-19 vaccines. So it does a fine job of mutating itself. without help from vaccine.
Thank you. Next question is, will the vaccine change my child's DNA?
Absolutely not, again. And Dr. Relucio, please weigh in. But it has nothing to do about the protein does not enter your own personal DNA and change the DNA of your body. It's merely a protein made from RNA of the virus so that it stimulates an immune response. Like I explained earlier, it gets injected into your body sees it as foreign. Your immune system creates antibodies so that if that in real time were to see that bug, your body would make the antibodies and squash it.
Thank you. Let me ask you a really practical question. What if your child is very afraid of getting a shot? What can you do to make the child more comfortable? How can you help prepare them to get the vaccine?
Well, a couple of things. I think communication and talking about that with your child and being also what is scaring you about getting the vaccine. And, most of the time it's a needle and it hurts. And you say, yes, I know, but you have received many vaccines before this. And we're going to your doctor's office again. It's not like any other time when you have gone to see your pediatrician or family practice doctor. That's why I think it is so important, and especially in this age group, that this age group from a developmental and cognitive perspective should probably come to their primary care office to receive the vaccine. It's somewhere where they've been familiar with, they know the people, and our staffs are experts in administering vaccines to children. So at the time of the vaccine, we will frequently use distraction as a tool because it happens so quick and it's done and they're like, huh? But I think communication with your child about what is scaring them and being able to try to reassure them that that's okay. And this is to help you so you will stay healthy.
Thank you. Another question just came in. If the efficacy wanes after 6 months, in what ways does the vaccine help get past the pandemic versus natural immunity?
I think once again, there's, the vaccine does prevent hospitalizations in most people and deaths. And I think especially in younger populations. So younger populations are likely to have a milder disease, but they can also transmit it to people that are more vulnerable. So I think you have to think about it in terms of not only what is the risk to your child, but what's the risk to other people that the child gets in contact with.
Thank you. And the next question is, what studies have been done on reproduction? Or, I'm sorry, put another way, will the COVID-19 vaccine impact my child's ability to have a baby someday?
No, so there have been no studies that have demonstrated that there's been a decrease in fertility as a result of the vaccination. And in fact, there have been reputable, societies such as the American College of Obstetrics and Gynecology that have recommended that pregnant women get vaccinated because they are more likely and more at risk of having complications of COVID-19. There's a risk of fetal loss. And there are many women that have gotten pregnant after being vaccinated.
Thank you. There are a couple of questions that sort of deal with some of the myths that are going around that perhaps you could treat together. Do COVID-19 vaccines contain microchips? Can receiving a COVID-19 vaccine cause you to be magnetic? These are some of the things that I think are floating around on social media, and it'd be great to have both of you give us a definitive answer to that.
Yeah, so as far as I know, I've been vaccinated 3 times and I am not magnetic, and I could tell this anecdotally just on myself. And so there is no evidence of that. There is no evidence that there's microchips in the vaccine as well.
Thank you. I've had
And-
3 shots too.
And same here. I've had 3 shots too, and I still haven't had like my steel water bottle like stick to my head or anything. And there's no evidence. There are no microchips in the vaccine. It's not made that way. It's a myth. It's fake news. It's misinformation. That is not true.
Thank you. Definitively, we have put that to rest. Okay, here's a different question. Can my child with asthma take the vaccine without any complications?
Yes, they can take it. And in fact, as long as they're not in the middle of a major exacerbation of their asthma or have another illness going on, we wouldn't usually vaccinate a kid who's under the weather. But given that we know asthma is an inflammatory disease and it's an inflammation of the airways of your lung. So we also know that the COVID causes inflammation to many internal organs. So absolutely, just like we in pediatrics, we recommend that kids get a flu shot, especially if you have an underlying respiratory condition. The same applies to the COVID vaccine.
And somebody asked, I think I saw this question earlier, which vaccine will my 5 to 11-year-old get when they get vaccinated?
They can only get the Pfizer vaccine. That's the only one that's approved for that age group. So Moderna is in the process of applying for that. But right now, as of today, there's nothing to suggest that that's going to change any time sooner, but it's Pfizer.
Thank you. I think you may have answered this one, but it's popped up again. Is there any known long-term effect from this vaccine?
Well, not that we know of. And, this is a new vaccine, but I don't think that is truly 100% known right now.
Yeah, and then just to, this is something that is constantly under monitoring. And there are several databases, aside from VAERS, which is really a small part of the data that is collected. There are, over 9 million people that are on VSafe, which checks you after you've been vaccinated for any symptoms, because that's another way that they can get a signal that there's adverse events. I think that, for example, the fact that, myocarditis was detected as a complication of mRNA vaccines in adolescents, and the thrombotic syndrome that has been seen with Johnson & Johnson this has all been detected because there are several surveillance systems that are looking at side effects as a result of these vaccines. And when that happens, it's something that, is communicated as promptly as possible.
Thank you. Well, I know I'm not supposed to have a favorite question, but I have a favorite question that just came up. If my pediatrician is not offering the vaccine, where can I get it?
Well, as far as I know, the private practice pediatricians are all offering it. And I know Olay Health will be offering it. And I understand Kaiser is offering it, but there's always our fail-safe, tried and true Napa County Public Health Department. So there's no reason that a child should not be able to receive the COVID vaccine in this age group. And I know if you truly wanted a vaccine and it wasn't available with your pediatrician or provider, you could certainly call my office and we would make arrangements to do that. This is about getting all the kids vaccinated so that we can have a chance to get out of these horrible past 2 years It's been awful. We're all fatigued of COVID. And, you know, the impact this has had on the people out in the field at the hospitals, taking care of these people who end up with serious COVID has been horrible. And it truly has now become a pandemic of the unvaccinated. And we have to remember that, because I think almost in every state, the people who are being hospitalized are unvaccinated. And you know, we're entering the holidays and winter. It's going to be cold and people gather in closer settings. And you know, if you really want to enjoy the holidays, the best way to protect yourselves, your families, and loved ones is to get vaccinated.
Yes. So we only have time for one more question, and I like this one too. Should I be concerned that my 11-year-old is getting a lower dose than a 12-year-old?
No. The recommendation is if the kid is 11, you should receive the appropriate dose for your age. And if the child at 11 in 3 weeks is going to turn 12, they should still receive the same dose that they started with. That is the recommendation from the CDC and the Advisory Committee on Immunization Practices, and it's supported by the American Academy of Pediatrics as well. And
thank you. We have run out of time, and I would like to thank you both for your absolutely factual, straightforward, clear responses to all of the questions, including some of the myths that are floating around. We appreciate so much you taking the time to spend with us today, and hope that parents who are watching now feel much more comfortable and will do just as you said, Joe. Go and get your kids vaccinated. Thank you so much, everyone, for tuning in. Thank you, Dr. Alucio. Thank you, Dr. Carrillo. And thank you all the staff behind the scenes who made this webinar work.
Thank you.
Thank you. Happy Thanksgiving.
Thank you.